This is Dr. Alfred Egedovo, your primary care physician. This is an hour, a time with your primary care physician, and my objective of presenting this program to be able to see the possibility of using our various strategies to reduce the burden of disease. And we, in our other program that we run in the Global Health Center, we have been discussing on how we can use the power of goal setting in creating success and reduce poverty, and at the same time use that strategy to develop our community. But as a professional in the health field, with training in primary health care, it has been my desire and a passion to see how the healthcare field interplay with poverty reduction and community development. And hereby, we launched this initiative to be able to give educational talk, health educational talk to our community as a non-profit organization. And the approach is to be able to present preventive primary health care. As I have seen a lot of patients, and some that have dealt with, I see, like mostly in resource restricted areas and the less privileged persons that are not able to have access to health care, and they don't really understand their health and how their body function. A lot of persons has made costly mistakes, but however, this very initiative is to be able to give relevant information and support those that will need our program. Like I have seen several cases of people, because of ignorance, this has caused them a lot of pain in their families. And this has tell a lot, even in terms of their financial life, and the burden of disease has caused a lot of sorrows to a lot of families. And like recently, I was talking to an individual was trying to, the children were having some like cough and having runny nose, and they tend to buy something from the pharmacy, and this individual did not know how to apply this, and he has to the content of what she bought was to irrigate the nose and to reduce the congestion. And because this individual didn't know how to use it, was putting the liquids, turning the head and putting the liquid inside. It means that liquid will go inside the lungs. That is an ignorant. But we want to see how we can help people and pass information to them that can be of help to them. And they can get to us and we give educational advice. But that is not to say that you don't have to see a doctor. You don't, when there is, when you are in a situation, you can call the emergency line and also go and see a doctor. And several cases, like I remember where I came from, and my aunt had cervical cancer, and one of the persons that claimed that he was a doctor took some extracts of the hair and put it in a syringe and inject it into the vein. And now when I think about this, it pains me a lot because of how some of these things has really happened to various people. And I was talking to somebody again. This little lady had an asthmatic attack, though she has not had that experience before. And they have to buy something, and instead of using a puffer or Ventolin and put it in the mouth and take a sip of it and put it and inhale it, they put it in the nose. And this individual was still passing through this pain and rigor. I said, okay, I told the father to go and buy Ventolin. And that was how the father was even saying it was like a magic. But had it been there is no such information, this child would have suffered a lot. But we are here to provide preventive primary health care information that can help you in the area of diabetes. Some of the complications that people have as a result of diabetes, some people losing their lips, some of them getting blind, some of them having kidney problems. It's just because they are not aware. So our desire in this initiative of community development and primary healthcare prevention of some of the disease that cause the less privileged people the fortune of their life, with our initiative, we will be able to give them information and guide them. With this guidance, we'll be able to help them to reduce some of the complications that we have from some of these preventable diseases like hypertension, even immunization of children. This will prevent some incident that happen in our life, even in the area of obesity. And those that are going through their menopausal hot flushes, we'll be able to guide them and give them information that will make them to be aware of what is happening in their body. And I'm going to stop this broadcast here. And every Friday, you will be having a time with your primary healthcare physician. Thank you very much. Once again, this is Dr. Alfred Egedovo using the preventive primary health care strategy in reducing burden of diseases in our community, thereby reducing poverty. Thank you very much. I will see you again in our next meeting. Bye-bye.